Floor is all yours.
All right. Thank you, everyone, for your patience. So I'm going to talk about how activity-friendly neighborhoods can benefit both non-communicable and infectious diseases. This came from a collaboration commentary that I did with Dr. Deepti Adlaka, and she is the United Kingdom connection, because she was formerly at Queen's University in Belfast, Northern Ireland, but just last week she relocated to North Carolina State University, and that's why I'm giving this presentation on her behalf. Next slide. So obviously, I'm going to talk about physical activity and its importance and designing for physical activity. I'm fortunate enough to live near the beach in San Diego, and this is a normal scene on our boardwalk and beach where people are active and enjoying themselves. So this was March 2019. Next slide. Of course, the pandemic had an effect on physical activity because many of the places that people most love to be active were closed, and you can see the boardwalk and beach are empty. Next slide. And Deepti found the exact same effect in Belfast. The parks and the trails were closed, so or managed in ways to make them less accessible. Next slide. One of the things that I did very early in the pandemic was work with Michael Pratt, a physician, to convey the multiple benefits of physical activity for the pandemic. And we published this, you see, over a year ago in this Brazilian journal. Next slide. So very briefly, we identified six benefits for physical activity. Maybe the most important was that when people are active, it enhances their immune function and reduces inflammation. And so it should reduce the severity of infections. Now, a year later, we have several studies confirming that this is the case, that people who are active and fit are less likely to have severe COVID infections. Another mechanism is people who are active have less risk of the chronic conditions that increase risk for severe COVID, because a very high percentage of the deaths occur in people who have chronic diseases like diabetes and heart disease and cancer. Physical activity reduces stress and can reduce cortisol, which is the stress hormone. And cortisol is another mechanism for affecting immune function and inflammation. And so physical activity is great for reducing stress. And then there's this, active people have less chance of getting this acute respiratory distress syndrome. And then also very important now is that physical activity improves immune responses to vaccines, especially among older adults. This hasn't been studied yet in COVID, but it's been studied in several other conditions. Next slide. So we think being active is very important. So our Deepti in our commentary was triggered by these early concerns about the effect of density on the pandemic. So here's the now former governor of New York saying the density level in New York City is destructive and we must reduce density. And on the right is an editorial in the Los Angeles Times that sprawl is saving lives. And we thought that this was completely wrong and a dangerous message. Next slide. So we wrote this commentary that was in a special issue of Cities and Health, a journal on COVID-19. And this was also picked up in the Conversation UK, based on the article. Next slide. So regarding density, we said, well, let's hypothesis has been put forward, let's test it. So we looked at something like over 30 cities worldwide. Now this is in June 2020, so now this is old data, but you can see that there's not a positive relationship between density and, in this case, COVID cases. If anything, there was a slight negative. So it's basically no relationship, and as you can see clearly here. Next slide shows a similar relationship with COVID deaths as of June 2020. And while the numbers would be different now, I don't think the result would be different now. Next slide. So we wanted to put across the idea that we need to distinguish between density, the number of people living in an area, and crowding. So crowding here is an example of meatpacking industries. Another instance of crowding could be, you could have a low density single unit neighborhood, single family home neighborhood, but maybe low income people live there, so they're crowding several families into one house. So so that's a crowding issue. So we wanted to make that distinction. Next slide. The other thing that we did in our commentary is to examine the built environment or neighborhood design attributes that have been linked to non-communicable disease risk, and mainly through physical activity. And you can see those attributes listed in the middle there. And you can see that all of them have favorable effects on non-communicable diseases like diabetes and heart disease and obesity, except the one that I called automobile optimized transportation system. So essentially low density, single use single land use that creates car dependence. So we know that is bad for non-communicable diseases. But then if we look at, and we don't have complete real data necessarily on the effects of these on infectious diseases, but physical activity as a mechanism, we do have data. So residential density, we showed in this that really there's no association there, not related. So, but mixed land use allows people are more active in when there's mixed use, so that help protects against infectious diseases. The same with automobile dependence. The sitting in automobiles a lot of the time raises risk. Public transportation is we think of it as active transportation, so it helps non-communicable diseases, but it creates crowding, which has an unfavorable effect on infectious diseases. Pedestrian and bicycling facilities, parks and trails, and then open streets initiatives, which thankfully became very popular during the pandemic, have favorable effects on both non-communicable and infectious diseases. So we thought this was an important message to get out, so that we don't have the pandemic stimulate land use policies that are going to be detrimental, probably during the pandemic and then afterwards for non-communicable diseases. And in throughout the world, we have to keep in mind that apart from this past year or so, non-communicable diseases account for 70 to 80% of all deaths worldwide. So very important. Next slide. So we made some policy changes related to policy recommendations about managing density more effectively. And you can see here the most important components of a well-designed density are investments in shared infrastructure. So parks and places to walk and bike and trails. And urban centers are defined by their interconnectedness of housing, transportation, food, and more. And so we think that the way to manage urban density is through 15 or 20-minute neighborhoods. So everybody can walk to where they need to go. So they neither have to use cars, which are worse for non-communicable diseases, and they don't necessarily have to use public transit, which might be a risk for infectious diseases. And so we also need to manage or mitigate infectious disease risk. And you can see on the right, commuters in Tokyo on the subway wearing masks. So, and I think many cities, especially in Asia, showed that you really can mitigate the risk in high density cities. Next slide. We've been encouraged to see a lot of editorials and articles about don't blame density for the pandemics and embrace density. And we can use urban planning to manage density. And an op-ed here showing Governor Cuomo, the problem is crowding, not density. Next slide. So we think that this has been the conversation has turned to a good direction. And so I just want to end with a little positive news about the pandemic. And I'm sure in many places around the world, you saw what I saw in my neighborhood. People would write things on their on the sidewalks to encourage people to keep good mental health and be active and do things like silly walks. So I would like to end my presentation there. And thank you for attending, and sorry about the technology problems.
No problem. Thank you for a fantastic presentation. I totally agree that density by itself per se is not a problem.